ready to sleep. Let the morning time drop all its petals on me. Life, I love you, all is groovy.
Hi, my name is Trenton. I'm the music therapist for Memorial Regional Hospital South. So the program has been in existence for almost 3 years, and specifically I use music to go after patients' goals. Sometimes those goals are related to health and wellness, and sometimes it revolves around neural functioning or motor functioning. And so I'll decide on how I use music based on music therapy research, based on music therapy training, and also the diagnosis and whatever the patient comes to rehab wanting out of their rehab stay.
Hi, my name is Stephanie and I'm the music therapist here at DiMaggio Children's Hospital. Music therapy is the clinical and evidence-based use of music as a therapeutic tool to accomplish physical, emotional, social, psychological, spiritual, and social goals. And so some ways that we might use music to accomplish those goals is, for example, to manage pain without the use of medication, to help with anxiety and depression, or possibly to help with respiratory distress.
Areas where Trent's been very, very helpful is with more difficult patients, patients that are very guarded and locked down. Many times music allows them to experience emotions that maybe they're not comfortable experiencing in any other situation. I think even today there was a patient that was very locked down during one of the groups, and with music began to cry and was able to kind of experience some of the pain that they had been holding back.
Known Stephanie since I came to DiMaggio. She has helped me since my heart transplant, and she has taught me how to play the ukulele, and I have also worked on my voice a little more, and I love her so much.
I love music. It's like one goes with the other. You know, the walking, and then you hear down, 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 and it makes me want to walk more.
I know that there have been some larger studies looking at music therapy and other sort of psychological, positive, motivational things with CFs, but on an individual basis, I can tell you that what we see when we walk into the rooms afterwards, the positive nature of the patients, they can't wait for Stephanie to come back and to play again. It's really, really important.
I mean, the things that I see every day are really phenomenal. I can go into a room and see a patient that is very stressed, anxious, fearful of the medical environment, and within moments of developing that relationship and figuring out what the patient's favorite music is and engaging them in a session, I can see that fear melt away. I can see the anxiety melt away, and I can see kind of normalcy come back to the environment. And so things kind of look a little less medical and just like they might in everyday life.
So there's nearly 70 years of clinical research in music therapy. And in the past couple of decades, research specifically geared towards neurologic music therapy has shown us that sound primes the motor system and activates the whole brain when engaging in music. And music therapists are trained specifically to use music as the impetus for change. And when a patient comes to us with impaired gait, we will use consistent rhythm to reprogram those movements into a more normal gait pattern. When a young woman presents with aphasia from a stroke and she's only humming, we'll use melody and rhythm to engage those language-capable regions of the brain so she can communicate her wants and her needs again. Instrumental play can stimulate and arouse the affected side of the brain, and a person can overcome hemispatial neglect after a stroke. Music is powerful.
Ain't it good to know that
You got a friend. Ain't it good to know you got a friend?
Nice.